Does PCOS cause some long term effects which are hormonal and the risks of cancer? Let's look at it. PCOS affects 5 to 15% of women in the reproductive age group worldwide. It causes a range of health issues such as excesses of male hormone, levels, fertility risks, risk to diabetes, psychological challenges. Despite its prevalence and impact, there's a limited understanding of how PCOS changes over a woman's life. How do reproductive and psychological and cancer related features of PCOS evolve over time compared to those who do not have PCOS? How was the research done? So, I reviewed 24 longitudinal cohort studies around the world, looking at around 62,000 women aged 15 to 49. What did they find? Hormone. If you look at the hormone changes, women with PCOS start with higher levels of male hormones, testosterone, and DHEAS. Over time, these hormone levels decline more steeply in women with PCOS than those without PCOS, but remain high overall. So, PCOS, in fact, starts getting better. Menstrual cycles. PCOS is linked to fewer menstrual periods, but some women regain more regular cycles as they age, with egg counts coming lower. What is important? The age of menopause is similar between women with or without PCOS. If you look at pregnancy outcomes, women with PCOS have a higher risk of diabetes in pregnancy, possibly pregnancy induced hypertension. The evidence regarding miscarriage and low birth weight is mixed, and we are not certain. Looking at mental health, depression and anxiety are more common in women with PCOS, but there's little long term data on how these symptoms change over time. The risks of cancer, mainly endometrium, may be higher in women with PCOS, especially if there are no periods for a long time, but these findings are inconsistent. And breast cancer risks are similar to women without PCOS. Why does this matter? It matters because one, PCOS is very common, and PCOS evolves, helps us doctors to provide care as well as counseling. For example, knowing that hormone levels decline but are remained elevated may influence how long women may be monitored for symptoms like hirsutism, excessive hair, and recognizing the persistent risk of diabetes as well as hypertension in pregnancy. Also, remembering that long term impact of mental health risks also poses a challenge. What are the limitations of this study? One is let's look at the overall how the study was done. Many had small or short follow up periods, and many lacked controls. Thus, getting out complete conclusions is going to be difficult. So, in short, we'll say where was the changes? The changes were especially in the hormone levels, risks of diabetes mellitus, and mental health issues. Evidence of cancer is still unclear. Thank you.